everybody. Welcome to Immune Recovery. Today we have Dr. Jacquel Patterson, who is going to share more with us about her holistic autoimmune journey and her area of expertise in helping folks navigate autoimmune disease. I'm Dr. Christine Bowen.
And I'm M. Bowen.
And we'll see you in just a minute. Hello, everybody. Welcome back. We are so pleased to have my colleague and dear friend and just general awesome human being with us today, Dr. Jacquel Patterson. Thank you so much for joining us.
Hi, thank you so much for having me. I'm really excited to be here on your program, and you're amazing in terms of what you do in your area of focus. So I'm honored to be here to speak with both of you.
Thank you. Em, did you want to lead the way and invite Dr.
Yeah, Dr. Jaquel, we would love to hear more for ourselves and for our viewers about your personal and professional experience navigating autoimmune disease using holistic treatments. There's a bunch in that sentence, so please start wherever you'd like.
Yeah, so I have a practice out of Fairfield, Connecticut. I've been practicing for over 15 years now. It's crazy how time goes by so fast. So I am a licensed naturopathic physician, also IFM functionally medicine certified. I also have 3 Amazon best-selling books and run a multidisciplinary integrative practice where we see people from kids to adults, providing the whole compendium of service, including naturopathic medicine, acupuncture, craniosacral therapy, nutrition, so a wide array of symptoms. And my area, or rather services, and my area of focus particularly is autoimmune conditions as well as Lyme disease. And also I do a lot of support around mental health, particularly anxiety, depression, and also ADHD. So those are my primary areas of focus. Autoimmune conditions was something that, and I'm sure I'm going to share a little bit more later about, how I came into this realm, but autoimmune conditions is something that is connected by way of family members that have had autoimmune conditions. And when I first went into practicing, seeing a lot of people that suffered from this illness, and naturopathic medicine is an area where we can really help by way of supporting an individual lifestyle, mind, body, the whole full connection, which is really, really critically important for an autoimmune condition. So happy to be here to speak. Again, practicing for 15 years, can't believe it's been that long. And every day that I'm, doing the work I do, I just get a lot of intrinsic value based on just the experiences my patients have and being part of helping to support them in their journey.
Thank you so much for telling us a little bit more about your experience there. If you would, since you're an expert in the autoimmune space, I would love it if you could tell our audience a little bit more about autoimmune diseases in general.
Yes. So autoimmune conditions are over 80 different autoimmune condition types. And it is caused by many different factors. There's genetic factors, environmental factors, also connection to infections, which I'm going to talk more about later. The most common autoimmune conditions that you may be aware of or have heard of, rheumatoid arthritis is one, type 1 diabetes, multiple sclerosis, lupus. Those are the most common ones, and it affects over 20 million Americans are affected by autoimmune conditions. Women are more predominantly affected, and they do believe there's a hormonal relation to that, and that's one of the reasons why. And also, especially particular disease conditions like lupus affect people of color, particularly African American, Hispanic, and the Hispanic population. So definitely more common in women. There are over 80 different disease conditions. The rates of autoimmune conditions continue to increase, which can be due to many different factors, including our current lifestyle as well as environmental factors. And how it works is your body will actually mistakenly attack itself. So it's not properly working in the right way as it pertains to, either fighting off infection, or in terms of its response to things, it's actually attacking itself improperly, mistakenly. And so it can affect different organ systems. Ones like lupus might affect, they call it systemic lupus erythematous. So it can affect many different body parts, including the heart, including the kidneys, including the joints. The most common symptoms that individuals typically have with autoimmune conditions are fatigue, joint pain, physical pain. Sometimes, if it's not managed well, it can end up landing in like kidney issues. But the most common, typically, symptoms will be seen as fatigue, joint and physical pain. And depending on what type of autoimmune condition you have, it may affect that particular area. For example, someone with ulcerative colitis or Crohn's disease, they will have more digestive issues as a result of that autoimmune condition. So pretty prevalent, as I said, continuing to grow. And that's why it's really important that we're having a talk about this, and for what you're doing in terms of what you're providing information out there about autoimmune conditions.
Yeah, rates of autoimmune disease are not going down.
Mhm.
They're going up. And so we see things like environmental toxins, that it's not just genetic. So, I mean, I'd like to talk a little bit more about your family connection to autoimmune disease. But as we've talked about before with our family, it's like, yeah, there's a lot of autoimmune disease as far as like, our genes are concerned. But then for each of us, there were different kind of preceding factors that then triggered the autoimmune disease to kind of come on. So first, why don't you talk to us a little bit about the genetic component, and maybe in your family, or some of the autoimmune diseases that you're seeing more in your family.
Yes, there is some genetic risk factor, particularly, and basically, genetics play a big role, but then the other piece that are going to connect it are there other, let's say, environmental exposures, stress, hormones, some other factors that can then really trigger or initiate it to occur. But when you look at genetic factors, if we look at something like lupus, I have a family history of lupus. My mother has lupus. My aunt also had, one of my aunts had lupus, and one also, many different autoimmune conditions runs on my mother's side of the family. Me, myself, I have a positive ANA. I also have had positive anticardiolipid antibodies. And what I see is those can go up and down depending on a lot of factors. My top usual factor is when I'm more stressed, I will see those antibodies go up pretty high. So sometimes what I often say to patients is that you can have those markers. If you look at something like ANA, which is anti-nuclear antibody, that often is run for lupus. It's run more particularly for that, but it can also be positive for other autoimmune conditions like rheumatoid arthritis, like Hashimoto's, like rheumatoid arthritis.
Scleroderma.
And so, in scleroderma, multiple disease conditions, but about 20% of the population will have a positive ANA, but not have an autoimmune condition. There's just like a genetic, basically, risk factor. And so what I say when I see people that have that, and it might be a low positive, is that, like, what do we do now? Because it might just be information that, information that we're getting for the future. And there are some studies to show that you can have these positive markers about, 10 or 15 years preceding it, as well as, looking at these infections and other things that are going to kind of activate or stress or lifestyle that can basically allow that to turn on. So about, again, 15 to 20% of the population could be positive for it, but do not have an autoimmune condition. But to me, it's just information about our body and why is it producing the antibody in the first place. So there are a lot of things we could do by way of interventions before it lands there. And this is one of the reasons why I actually love seeing patients that are in the middle, where they have some symptoms, but not enough to be really diagnosed with the disease condition, and they have a family history. That's a great time to do it, because a lot of these autoimmune conditions might not show until 10 or 20 years later. And so There are a lot of studies, which is Dr. Christine Bowen's focus on gut health and the gut microbiome. And so many of these things you could see changes, for example, in the gut microbiome maybe 20 or 30 years earlier before they get the disease condition. So it's great. It's really important to advocate and to get tested. If you have some of these symptoms that you may feel you have it, you may be going down that path. And this is when it's a great time also to see a naturopathic doctor that can really intervene in the middle. I think to me, that's an area where we're really strong at, that part where it's in between diagnosis.
That's so important, because oftentimes people will have either the beginning symptoms, they might have suspicion, they've seen family members go through having autoimmune diseases, they feel like I'm getting ready to go down that pathway and I don't want to. You go to your primary care, maybe they do some tests, maybe they don't, maybe they send you to a rheumatologist, maybe they do some tests. Even if the tests come back positive, they might still ask you, like, how miserable are you? And then at that moment, it's like, well, do you want these drugs or not? And because that's pretty much your only option if you're going to a rheumatologist, is going to be medication interventions, instead of like, is there anything else that I could potentially do to head this off at the pass or prevent it from going the same course as your family member? So your advice would be, if you have symptoms, people are not taking action, you have maybe a positive ANA, maybe you don't, maybe you just have symptoms, consider seeing somebody who's in preventive medicine, like naturopathic doctor or functional doctor, and see something like a stool test to see what your microbiome is doing, like maybe that, or food allergy panel. There could be things that you can find out about what your immune system is doing and see if there are simple corrections to prevent it from like going down that path. That's so important. And so if somebody has a positive, ANA, but they don't have symptoms, what's your advice to them?
I was just and I was just going to add that what you just mentioned, like the stool test, the general lifestyle pieces of what can we do, because the stool tests are great because they have had a lot of connections with, for example, individuals with autoimmune conditions. They tend to have lower levels of things like lactobacillus, which is the most common bacteria. We look at lactobacillus, bifidobacterium. So lactobacillus is one which you will get picked up in a stool test, and the one that has been shown to be the top in terms of deficient for people with autoimmune conditions is Lactobacillus reuteri. And so there's these different bacteria based on different autoimmune conditions. There have been huge connections with definitely disease conditions like rheumatoid arthritis, lupus, MS, IBDs as well. And so what I would say is what we were just talking about is that's a great time to just see a naturopathic doctor just for prevention, because unfortunately the way the medical model is right now, there's really nothing you can go to. It's not like they could put you on a in that intermediary part other than medication. And so what happens is people are just stuck and they're just almost waiting to have a worsening of symptoms before they're put on something. And so there's a lot that can be done before that actually happens that could either hopefully prevent that from occurring in the first place, or delaying the onset of it as well.
This is huge, because I feel like oftentimes the advice from the rheumatologist is come back when you're miserable enough to consider these medications, right? Instead of saying, oh, let me point you to somebody who can help you with prevention. Symptoms don't have to just get worse. They could potentially improve. You could do things, other interventions to improve them, but they just don't have those tools in their toolbox, right? Mm-hmm. So it's like, well, if you're thinking, gosh, is there some other way, then this is exactly the sort of like program or community that we want people to know about. And there are professionals out there like Dr. Jaquel that have this area of expertise. So just knowing that we're out there and that we're here for you to work on prevention, so that you don't just have to be like, well, the stage is set, it's just going to get bad. And when it's bad enough that I say, okay, enough, I'm going to go and get medications. And that's the end of the story. It's like there are 12 different paths that you can go down instead.
Exactly. Yes. So we're not limited. There's always options.
Exactly. So when it comes to something like getting diagnosed, like Em and I both have talked about this a little bit, but we've had some challenges in getting diagnosed, and so I remember like being 25 and not being able to like walk, really terrible joint pain in my ankles. But it wasn't until just like 6 years ago that I even was diagnosed with a connective tissue disease. But that it's like that was the very beginning. That was like, yeah, we're just going to say over 20 years ago, that the symptoms were there and I was young and healthy, but there were already symptoms, and all they did was check rheumatoid arthritis markers and then just said, nope, see ya. And since then, we've learned things like how food triggers our joint inflammation. So I feel like it's hard for people to get diagnosed. Could you tell us a little bit about self-advocacy, or how people can be their own best primary care, in fighting for really getting better answers?
Yeah, so I know for autoimmune conditions, it's about somewhere about like somewhere around 6 to 8 different providers, physician types that they see before getting diagnosed. The other area of focus for me is Lyme disease. It's very similar, and the reason is there are a lot of symptoms that overlap, like fatigue, could be because we're tired, and especially women in healthcare too. Tons of studies that there's a difference in understanding of our pain tolerance, or dismiss as sometimes anxiety or overwhelmed, or we're just too stressed. And so when you say something like, I'm really tired, I'm dragging all day, and you have young kids, they could be written off as, well, you're not getting enough sleep because you're staying up late with kids, or of course you're a busy mother. And so what happens is these symptoms end up happening for a long time because they're written off as other things, or you're taking an extra cup of coffee, or you're taking your Red Bull, or you're doing something else to offset that for energy. Body pain, people will kind of ignore body pain too, until it's significant enough that it's kind of causing a quality of life issue. So in terms of advocating, I usually tell, it's not normal. I've done like talks on it. It's not normal to feel tired all the time, all day. It's not normal after a certain period of time, after a few weeks, after a month. That's not normal. It's also not normal to be having a lot of physical pain unless you're way, way older and you have, let's say, like osteoarthritis or something like that. But I have people that are in like their 20s and 30s that are having a lot of pain. That's not normal. So anything that's feeling, or even some symptoms of autoimmune conditions can be like headaches and continued headaches, and maybe the medication or things you're taking aren't seeming to work. You really want to make sure, in terms of advocating when you see your doctor, that first of all, they put their hands on you. I've had that happen a lot, where a patient says, I'm the first one that's actually even touched their thyroid or has physically put their hands on them, especially for younger people. Because again, they might be written off as it's in their head, or they're stressed out, or they're anxious, and maybe you need to be put on an antidepressant or what have you. So that I see a lot. And so first is definitely making sure someone is actually testing, touching you, et cetera, making sure, advocating for comprehensive blood work, and asking why, like what would be the reason why I'm inflamed? Why are the other reasons of being fatigued? Obviously, you want to look at your current lifestyle factors, but can other things be worked up? A complete blood count, even basic things like your iron. Can they run an autoimmune panel? There are general autoimmune panels that they would know to run. So those would be the biggest things, is again, like physical exam, making sure that blood work is very, very comprehensive. And then also making sure, I always tell people to kind of bring a list of questions. I have to do that myself when I go to the doctor, because we forget as we go and see them what our major complaints of going there are. And so that's where it's a great thing to actually write it down for when you go to the doctor, so you feel heard and you don't feel like you're dismissed, and that all of your questions are answered as well. So that's where having that helps. But then also with a naturopathic doctor, Dr. Christine, the same, we spend a lot more time with our patients. So we often have that time. And sometimes in the current model of care, people might only have 10 or 15 minutes with their doctor. So that makes it even more important that you're really writing down your key pertinent questions, so those things don't get overlooked, and you get put to another specialist, and then years go by and you still aren't diagnosed, but you feel really bad. And I get to hear those stories all the time. I just had another person today that I saw that it was 6 years before she was diagnosed with lupus. And at that point, she already had had some organ system damage, but had those symptoms and had been seeing doctors, including rheumatologists, for 6 years prior to diagnosis. So
that is so frustrating because it feels preventable, and that this person's time, not just their time was wasted, but their body function
exactly
was being destroyed while people were just like scratching their heads or on to the next doctor. Like, how do you know when it's time to move on if that doctor is just like not going to do it for you?
Yeah, if you still do not feel well, or I tell people that with other disease conditions like thyroid, they'll say, okay, I got on thyroid medication, but I still feel exactly the same. Then you need to go back to your doctor, advocate, talk to them about how you feel. And then that should be changed, right? So that you should be coming back in a place where you're feeling better. If that person is not listening, then you have to, unfortunately, search for another doctor. You have to find the doctor that is going to be able to advocate for your needs. Because at the end of the day, we're here to really serve the needs of the people that come into our door. So if you're not having a person that's like you feel fitting or hearing you, you absolutely have to go and seek somebody that's going to do that.
Like somebody who's dismissing your symptoms, somebody who you feel like is not listening, not taking action, then it's like, don't waste your time there.
Yeah, get a second opinion, because it's your health at the end of the day. So I always say, sometimes my patients will say to me, I know this sounds weird, but I feel like this happened ever since X. Or I feel like this happened, since I got sick with this or stressed, or they'll mention something. Or they feel they might have gotten exposed to, let's say, mold or something, and that's where the symptoms begin. I often tell people, like, you really have to listen to that. And even though I'm the doctor doing my detective work and asking a lot of questions, I find that people often know their body, not people. Most people, if you really listen, you know your body and you know the answer to it more often than you don't know. So I will kind of take that, hear it, and then really run with digging into that, because it typically is always right. So I think we know more, but we just write these things off. And then unfortunately, we think if they say it to the doctor, they're going to be looked at as though that doesn't make any sense, or that was not the right thing to think, or the right methodology.
Yeah, I have a lot of clients as a massage therapist who come in to me with joint pain, and they've taken the time to see their primary doctor, and they've maybe had some x-rays done. And almost universally, they're just told, like, you have arthritis in that joint. People in their 30s all on up, they're just told, like, it's irreparable. You can take some anti-inflammatories, but there isn't a query of, you didn't have this, now you do. If it's not obvious mechanically that you would have had this wearing of the joint, what's going on? So I really just appreciate what you're pointing out are these signs for us to get curious about early on. And if you know there's these new patterns of things developing, and there's been a pivot, right? We talked to Dr. Iris Crawford about hormones, so we can have hormonal shifts that predicate some of this. We can have large stress events. So I just really appreciate, I'm hearing you tell people about how they can investigate what's going on with them, get a good diagnosis, but also in the absence of a diagnosis, there's still all this proactive work that folks can do, so that you can do things so that you don't ideally end up with lupus like your family members. We can all do things to either, we're focused on reducing flares for folks, but I feel like the next step is the next generation going, I don't want this expanding group of people having autoimmune diseases to include me. And so what kind of supports, working with naturopathic doctors, functional medicine doctors, to prevent those things that might end up in place to create that. So I just want to say from my heart, I really appreciate it. And I know that a lot of doctors are doing their best, and if they don't have this expertise, if they didn't really study it, then they might write off these individual things like joint pain.
Mm-hmm. Yeah, and then also too, and to your point of I'll also have people say, they go to the doctor like, nope, that's not RA. Oh, definitely not lupus. So I say to them, the patient, like, did you say, well, what is it? What? And it's like, because there's sometimes a matter of fact, you don't have this, and it's like, okay, so what do I have? And so a lot of the, people will come back and they're like, but I wasn't given anything though. I was just told I don't have this, this, and this. And I definitely don't have this, but I still have positive numbers and I still feel junky. So what am I supposed to do? So I'm always like, that's not enough to just be told it's not this. And then you just walk out the door and you still have positive lab tests and you still feel like junky. You need to go to somebody else then.
Yeah, our favorite question is why? Why is this happening? Mm-hmm. And I feel like maybe the current conventional system doesn't allow people to, at least allow the providers to even think and have a chance to ponder something or to order a little bit deeper testing. There's definitely no time to get a full health history,
10
right?
Minutes, 10 or 15 minutes, yeah.
Yeah, so like a full health history, like forget it. So definitely go with your list of questions and hope that they at least can address those. But oftentimes they'll be like, that's 3 different subjects. You're going to have to come back for 2 other visits to talk about all these questions. You can't ask all the questions about your body like it's a whole system. You have to ask only one question about one part of your body at a time. And for us as holistic doctors, we're looking at the whole person. We're looking at everything that's going on in your system. Because you're a whole being, you're not a finger. You're not one inflamed finger or one inflamed toe. It's all part of this greater system.
And I think that's also why so many people see so many specialists, to be honest. I think part of it's the time. If I have 10 or 15 minutes and I understand those limitations and someone's going into this, it's like, okay, let me have somebody else work up this piece. And then you go to the rheumatologist and they're not sure, let's say headaches and things like that. It could be because of multiple reasons. Like if you have lupus, seizures is a common symptom, but it's like, okay, well, you're going to go to a neurologist now to work that up, which, obviously the neurologist has to run the test and that makes sense. But it ends up becoming then people are seeing so many people and no one is there to like piece it together. And so they're just like, I don't know what's happening. And I think that's the place that we end up being in as naturopathic doctors. They kind of come because the fact that we have more time with them, we end up kind of gluing that piece together because there's not really someone talking. There's not like a nurse navigator, or I feel like everyone should have their own navigator because there's too many different doctors and you don't understand why you're going to all these people. So it gets like very and on everybody's side. And the doctor too doesn't know when we're repeating things that were done by somebody else. So it's really, really interesting. But this is a great space in which we as naturopathic doctors can do well by way of, like what Em said, prevention. And then for many of us, it's maybe not prevention, but it's like I always say, even with autoimmune conditions, lupus or whatever it is, I might get that in the future, but hopefully I pushed it back at least 10 years or 5 years, instead of getting it at 49 or 50 when my mom has it, maybe it's at 70 or something like that, that there's less deterioration of my body. So there, things like that too, of, what can we do to do at least one of those 2 things. So
it's like, excuse me, through prevention, oftentimes we can calm inflammation, but once the damage has been done to joints or to kidneys, like that damage may not come back. Mm-hmm. So there's a lot of things that we can do to calm inflammation, but really early intervention is like the best thing that you could do for autoimmunity instead of watching and waiting. Watching and waiting is like, let's just see if it gets so much worse, and then there are these things that are changed permanently and that we can't fix them, instead of like, let's do early intervention. Even if we think it's over the top to intervene, it still feels like it's a much better road to go on. One thing that blew my mind, so I've specialized in autoimmunity and digestion, and that there was a link that tied these 2 things together that somehow had never come across my desk, and it just blew my mind. So I would love for you to talk to us a little bit more about how infections can trigger autoimmune or inflammatory conditions.
Yeah, so there have been many studies around infections and its relation to autoimmune conditions. They've even seen with the last, I'll be mindful, post-viral illness. So we know we're talking about post-viral illness, and actually increases up in terms of studies for type 1 diabetes already, MS and Guillain-Barré syndrome. So there definitely have been connections, and we're looking, in the last year, look at how many people had what they call the triple-demic flu, Rona, also what RSV was really high this past year. And, it makes me think, are we all of these infections, if our immune system is not cooperating effectively, is it increasing that chance of that precipitating piece that's going to just allow that kind of explosion for autoimmune conditions? So definitely one of the other connections they have seen is that autoimmune conditions, there is connection with infections, continued infections, and persistent infections, increasing our likelihood of having autoimmune conditions. And they found that most people with autoimmune conditions will at least have two infections that could be connected to initiating the factor. So one that's been most talked about is what's called molecular mimicry. But there are three different ways of immune activation. There's something called bystander activation, which is basically it's very common, like rheumatoid arthritis. It would be an example of it, where there's this kind of inflammation that causes inflammation everywhere. Then we have something called epitope spreading, where you have this antigen presenting cell which gets expressed and kind of spreads to different throughout the body. And then the one most studied is molecular mimicry, which is where your body, these infections, so for example, EBV, which is Epstein-Barr virus, has been implicated in a lot of autoimmune conditions like lupus, as well as Hashimoto's. In fact, they found over 80% of people with Hashimoto's had what's called EBV, EBNA antibodies. And what they find in what's called molecular mimicry is that these viruses actually are very similar to the autoimmune condition. And so what the body does is it thinks it's similar, and it causes this overt reaction, basically this antibody reaction, and the body basically thinks it's an autoimmune condition. It starts attacking itself. And so there's been connections, particularly EBV is a common one. All the different autoimmune conditions are connected to different, basically different viruses, different illnesses. Like rheumatoid arthritis has been connected with Proteus, Prevotella. When we look at HLA beta 27, Klebsiella, which they often check for ankylosing spondylitis. So there are very clear infections. EBV has been one of the most known. Epstein-Barr virus, particularly as it pertains to disease conditions like lupus and Hashimoto's. So I always, when I have patients with autoimmune conditions, I'm always checking infections. I often see people too with autoimmune conditions, when they get sick with one of those infections, their numbers will go up. I saw that with a lot of the post-viral illnesses. I've seen it with Lyme disease, where a patient will have Lyme disease, their rheumatoid arthritis, the RF factor, their antibodies will go through the roof. I've seen people's autoimmune, like their ANA markers, literally triple after they get sick. So there's definitely a connection with it increasing inflammation and potentially thinking that your body, causing that body to attack itself, thinking it's the same thing.
So things like having too few of certain types of protective bugs, we'll call them bugs, in your gut could definitely leave you open to developing autoimmune disease. Having too many or the wrong types of infections or these bugs, they could be viruses, they could be bacterial infections, they also could then trigger. So it's like not having enough of the protection can trigger, having too much of these other ones. So molecular mimicry is like a case of mistaken identity. The immune system is trying to respond to this infection, but oh whoops, like we decided to start attacking the tissues instead. So that's really it's very fascinating, and it's also awful. But that's like when you said gosh, I felt really well until X happened, until I got this illness, I had this life stressor, I got a round of antibiotics, I started this medication, like whatever that thing is, it is that the final, straw that broke the camel's back there in the moment, where it's just like, is it, the thing that just causes the system to explode? Yeah, it's like the last thing.
Tell people it's like a scratch. I'm like, if you keep scratching over a period of time, you're going to, bleed. So it's like after multiple things, or like what you said, the last straw, it's going to be that piece. And even with, like we talked about molecular mimicry, I talked about bystander activation, I talked about epitope spreading. Regardless, any infection is going to increase up inflammation, increase up cytokines, which are, pro-inflammatory, and then cause your body for autoimmune conditions. The one that are most connected are like Th17, as well as the and the Tregs. And so,
and those are immune system cells.
Yes, exactly. Immune system cells. So you're constant, and they're very connected, like Th17 with autoimmune conditions. So if you keep causing this like pro-inflammatory response, you're going to cause an issue with homeostasis of those two, and that imbalance is always going to lead you to be more likely to have an autoimmune condition as well.
So now we've talked about all this horrendous stuff that can happen, right? And then how you get diagnosed. What about treatments? Like, what are your favorite treatments or treatment tools that you like to use with your clients?
So, so the first thing is I really want to make sure to test for other infections, the blood work, to make sure there's nothing leading up to it that I need to address, which could be different depending on which one it is. Like you, gut, I always say anybody that's doing autoimmune conditions, if you don't kind of start with that, then that's usually, that's like the first thing, because if you look at autoimmune conditions, as you know, over 50% have an issue with their gut microbiome. So that has to be definitely connected. And it teaches in terms of commensal bacteria, what should be there, what shouldn't be there. And so if that's not stable, I always say that's going to help long-term. So really making sure there's a good amount of, in terms of foods, that you're getting a lot of prebiotic foods like leeks, making sure you're eating, food, garlic, onions, things that are going to help to fuel it, and then fermented foods as well, sauerkraut, kimchi, different things you could do by food. So I try to see if people can incorporate that with food for gut health. And then looking at, if I would do like a stool test to see, do we need to add particular types of probiotics? Everybody's different. Some people are sensitive if you introduce it too early, so you might need to do things more to feed and stabilize the immune system. So I like to look at definitely gut health, testing for food allergies, food sensitivity. A lot of people, if you do have autoimmune conditions, will have leaky gut, and you might need to be put on something to really repair the lining of the gut. Many different things to use for that. Glutamine is one of the most common ones and has been heavily studied. So typically gut is going to be a big piece. The next thing that's one piece of it. The first thing I often, though, am doing is some of the palliative of just helping with inflammation, because I always say to people, if you're fatigued, if you're tired, or if you're in pain, those two things, if I don't fix those, then you're still not going to be happy. You're still not going to feel like you're not well. So I could have somebody come to me, they had headaches, they have swelling, like edema, they have vision issues, dizziness, balance. I can fix all those things, but if they're tired, it doesn't matter. They're tired. So their whole quality of life is impacted. Or if they're having pain, it doesn't matter. I could fix everything else. So I usually always have to do something particularly for those two things. Pain, some of my common ones I use. Turmeric, heavily studied. Quercetin is another one. Quercetin I love because it actually blocks something called the LOX and COX pathway, both pathways. But it's also great for people that are more allergic, like have more of an allergic response or hyper response, which a lot of autoimmune conditions, individuals with it suffer from. Boswellia is another one. So there's tons of different things that help with inflammation. Although I don't like that as a long-term approach, I really do it for more of an immediate support for somebody. The other thing I like to definitely manage, so gut health, helping them with the inflammation. Stress management is huge. That's why I'm often testing for their cortisol levels, melatonin, because that will increase the inflammatory response in the body. And what I find often is one of the reasons for the flares that people are having if the stress is not monitored. So we always have to do some modification for that. And then the other thing is just general immune modulation. Like, what do we do for immune modulation? Some of my favorites at the office specialties we have is something called low dose immunotherapy, where it's related to this whole concept of molecular mimicry, dead or radiated protein of different bacteria, or viruses like EBV, like Lyme disease, et cetera, that we provide to people to help allow for something called antigen acceptance, so the body is less reactive to that. Also things like arachidonolactin, or we talked about prebiotics. Those are all more immune stabilizers. So I try to make sure the immune system overall is as foundationally strong. And then in terms of lab work, the other things that are really important for me to look out outside of things like stool tests, outside of what we talked about, like autoimmune markers, is also hormones. Because for women in particular, I'll see that if their hormones are imbalanced, their flares are going to be way, way worse for autoimmune conditions. So I usually have to support their hormones in addition to everything else they're doing, because that will often initiate a flare if their either menstrual cycle is not like they're having a lot of PMS like symptoms, and or if someone is going through menopause, like perimenopause or menopause. That's often a time of onset for autoimmune conditions as well.
Yeah, that hormone imbalance also can be one of those major triggers for autoimmunity. So that makes a lot of sense, especially after the information that Dr. Crawford shared with us about hormone balance or imbalance and how common it is. And then it comes back to your point of stress management. Seems to be one of the ways, or even like cortisol or adrenal hormone management, instead of just saying, oh, we need to meditate more, we need to do more yoga. Like, yeah, some of those things can be helpful, but somebody like yourself or Dr. Crawford helping you balance your hormones is going to be a huge help, instead of just being like, just less stress. It's like, oh yeah, I'll get right on that,
Yeah, because sometimes you can't even see through clear enough to be able to even think about meditating. So you have to just provide a little support, even if it's 15% of improvement or 20%, where that you actually feel like you have the capacity to do that in the first place.
So that's what you were saying, is like symptom reduction, like support for symptom reduction while you're still working on those deeper issues, so that somebody feels well enough to start doing the treatments that you're asking them to do.
Exactly.
Oh, that's an awesome approach. So you know us from, being my colleague and my friend, but you also know us from the Immune Recovery Program. Is there anything that you'd like to share with our audience about the program or our approaches, or like how it's constructed? Like any feedback or anything that you'd like to say about Immune Recovery?
I would just say you need to be in this program, in terms of immune recovery, because of everything we just talked about, and you can't do it alone. You really need a community. There's tons of studies on just like community and longevity, like having a community actually even allows for us to live longer, right? So community is going to allow you to have a place to ask questions, share wins, like-minded people that are sharing in the same struggle. That's a hard find. There's not many people that even focus on autoimmune like this type of work in particular. So I just think that it's just something that's like much needed, because the community is really everything, so that you have that place that you don't have to feel like you are turned away and you're going to 7 to 9 different people. You don't have your questions answered. You feel like no one's listening to you. You'll actually feel heard. And so provide all the right tips in your program to be able to offer that for people to get back to the place they need to be.
Thank you. Yeah, let us be one of the tools in your toolbox for prevention or for treatment or management of your autoimmune disease, or even inflammatory conditions that haven't manifested into the true autoimmune diseases. But thank you so much for all of your time and all of your awesome information. And before we sign off today, can you tell our audience where they can find you?
Sure. Yeah. So on Instagram, I post a lot there at naturopathic.physician. Also, in terms of my practice, it's Fairfield, FAIR, Field Family Health.com. Definitely connect there. Like I said, social media is typically the easiest way to connect in with myself and the team, but very happy to be part of this. Highly support everyone to participate in the immune recovery program and services you guys offer, because it's also such a great collaboration with you and M. It's just a different, it's not just one person. It's kind of in terms of collaborative approach, and I think that's really needed in this space. So.
Yeah, sometimes I'll get stuck in the science weeds, and then M's in the like heart and mind weeds, and so it's fabulous. I feel like it definitely balances out. Thank you so much for coming today.
Thank you. Thank you for having me.
Please subscribe to our channel and hit the notification bell to be notified when we post new content.
Make sure to follow us on Facebook and other social media.